walk in that place and you like love it, and they're pushing you and they make you feel like you're on fire, that's the place you want to be. Hi, everyone. Welcome back to the podcast. Welcome to any new listeners. Welcome back to any followers and listeners that have been around for a while. What is happening in my life? Life is fantastic. Kids are in school still, enjoying that. Back on rhythm. If you guys don't know, I just finished, but I'm actually continuing on with a cut week, a weight loss, short term cut week, progressing back into a smooth transition into normalcy again. For those who don't know or follow me on Instagram, Chris Garcia DPT, I just finished the first week and I lost 9 pounds. So I went from 198.5 to 189.5. I hope that math adds up. Anyways, I just finished that, and that was 9 pounds, and that was pretty amazing. I I love the challenge of this weight cut. It's a calorie cut, sodium cut, carb cut. And it was first introduced to me by a client who does professional MMA. And we just explained, we were just talking one day about how they make weight for an event and then have to, they cut for, 1 to 2 weeks. And on a day of the weigh-in, the next day they have to perform at their very best. And it literally is a life or death situation with them the next day. So it's interesting to me to be able to maintain performance while you deplete resources coming in, like you're diminishing a little bit of muscle mass, water, fat mass, and then to go in the next day and be able to perform at their best. That was fascinating to me. So I did it, and it was miserable. The mental challenge is really, really tough, and I enjoyed every aspect of it though. Just like constantly hungry and good challenge to the brain. So finished that. I'm progressing back into it. So I've already lost 1 more pound, but I'm going to come right back up pretty shortly. So that's what's happening in my world. Let's get on to this podcast. Uh, why did I come up with this podcast? We've been doing a lot of interviews for new physical therapists at Sports Performance. And I love having discussions with the interviewees and then also with my team. We do every quarter, we have reviews with team members, and it's and as a team. And so we talk about what have we done well, like all the wins and successes, and then what are we not doing well. And every quarter you'd imagine like, well, it's the same stuff. And actually it's very different because there's definitely seasons of clients that we see, and people's lives change, and so it's good to refresh. So we do this every quarter, and I love having these conversations with team members because then I can figure out like what could we have done better. And when people come on board, I've seen every range from new grads to established physical therapists, and I learn a little bit from every single person I engage with, and I love it because it just goes back into my brain on like how do I um, from my experiences and those that are coming in, like how do we improve that? What would be the message to somebody, aspiring physical therapist or a new grad? What do you want out of your professional career? And I titled this, my advice for new grads interested in sports PT. And there's a lot of different directions we can go, but I wanted to share conversations that I'm having with interviewees, or I'm listening to the interviews, and this is what I'm hearing, and from team members who've been with us, and the voice that is the feedback that's been given to us, and combine that with my experience and how I mentor physical therapists. I think it's important for you guys to know some of this just to be able to help you guys in your professional career wherever you are. And as I mentioned before, you might be a third-year physical therapist on your way out and you're excited to get into the workforce, or a new grad and you're excited about your new job, or you hate your job and you're trying to figure out what to do, or you're established and you're just trying to enhance. So in either case, if you're in sports or you want to get into sports PT, or you're in sports, you want to make sure that you're actually improving all the way through. So my advice, I think that at some point in your career, you have to think about, um, are you going to do a residency, or is a residency for you or not? And we'll do a whole nother podcast on just that topic. But this podcast is for the non-residency goers, right? So somebody who has gone into a residency, um, this might be applicable, but you're taking a different route, and I'm going this direction. So if you're not going to do a residency, which residencies are not for everyone, just like college, just like PT school, just like life, it's not for everyone. And so if you're going non-residency route and you're interested in sports PT, this is a podcast that you have to listen to. So, um, my first thing is for somebody who's not going into residency, um, the first thing you have to do is decide on what's the path that you want. Okay, I know that sounds really basic. Let's start there. What do you envision your career to look like in 3 to 5 years? Do you want to work pro sports? Do you want to work with professional athletes? Do you want to be seen as that best physical therapist in that clinic that you're working in, or in that setting? Do you want to work in a high performance institute? Do you want to, specialize in ACL return to soccer? Everybody has a different vision based on the framework you came into the profession with. And for me, I I didn't I didn't set that path. I never knew it. I just know, much like many of you listening to this, I just knew I just wanted to be in professional sports. Like I just wanted to treat athletes. That's all I knew. And in hindsight now, as a mentor, as a coach, as a colleague, now I see the value because one of my last points I'm going to give you today um, was a derouter in my life. And uh, I think it's important for you guys to keep this in mind as you go through this journey because I think that knowledge is not power. I think awareness is, and so that's why I try and bring this guys to your brains, to your heads, so you can kind of start thinking about them. Even if you don't make decisions now, it's fine. At least you like have little like pieces of knowledge that you can think about as you go on your journey. And so you want to create a framework. What does 3 to 5 years look like? And I know that's so hard for you to conceptualize, but it's very important. Just like, all right, you got 10 seconds right now. Like think about what does your dream life look like professionally in 3 to 5 years? Are you teaching at a university? Are you a clinical director? Um, are you traveling? Are you somewhere? I don't know. Whatever it is that you decide, and or do you want to be the mentor? Do you want to be the one who's mentoring other people, right? Or a clinic director, or whatever it is that you want to be. And once you kind of get a general idea, and you have every right to change that along the route, but as long as you know that, right? What if you're like, hey, I want to get 3 to 5 years under my belt of treating, and then I'll decide from there. Okay, that's actually a good, solid plan. If you do that, and I think that's very healthy for a lot of people, that you lock it in that you're going to be doing this so you can get the groundwork in, you can put in the time, you can get all the lessons, as many lessons as possible, you can see as many people as possible so that way you can generalize and create a framework around your treatment style. I think that's very admirable. And it speaks to my last point that I'll bring up a little bit later. All right, so you got to decide what that path looks like. Let's take the person who is like, I want to be the best. So that means that you got to put in the reps. You got to see as many people as possible. As many qualified people within the specialty that you want. So if you're trying to do ACLs and you work in a geriatric clinic, that doesn't really work. So I think that once you set that plan, everything else trickles underneath that. Okay. So first and foremost, you got to go to an environment that like excites you. So I understand this dilemma for many who are going to come out with debt, with student debt. You get this dilemma of income to debt ratio, and you're like, what do I do with my career? I obviously have this passion to work in this population, and it comes down to nobody can answer that for you. That is 100% a personal decision and what drives you. And I've said this before my previous podcast. For me, my grandmother was my driver. She was the one who really caught my attention for changing people's lives. And I helped her rehab after a post-op after a hip replacement. And that to me was the most rewarding thing on the planet, giving quality of life back, or getting somebody to a new stage of healing, or just making people feel amazing again. And all those things were very important to me, and that feeling is the fulfillment that I get when I work with anyone. It doesn't even matter. Even in coaching, now that I do that with physical therapists and mentoring, that is the fulfillment, because I'm still helping you achieve more. I'm actually helping you think bigger than just learn how to manipulate the knee or whatever it is that you do. That's like 2 minutes of gratification. It's actually learning what the fulfillment is that drives you. And I think that's very big. As a new clinician, you're not really thinking about that. You're like, I just literally want to be, I want to do a PRI course or SFMA course, and or whatever it is. And like, you're just driven by the skill set. And I think that's very dangerous, because you need to take a step back and figure out what the route looks like. What's the journey look like? And then you have to secondarily find the actual team or facility that's now going to facilitate that. And then you have to decide, does this mathematically work with paying off debt and living the quality of life that I want? Or are you willing to, skimp a little bit, eat some ramen, and live a very humble, modest life, but get the fulfillment that you want? And that is a very deep, hard question, or challenge that most people will have. And I get it. I live it. I loved it. I have lived it, and I will continue to live that same style of framework. Like, are you doing what you love? At the base root, did you go to school for the right reasons? And then, are you working in your facility or your environment for the right reasons? And for some of you, that might be a big question. And nobody can answer that. I think you need to talk to enough people to help you solve that. So, assuming that you have your 3 to 5 year plan, I want to be a master clinician in the shortest amount of time possible, and I'm not going to residency. Sounds good. Then you have to go into the environment that excites you and is going to push you. You have to, or else you're not going to do it, because you're human. And in these interviews that I've had with physical therapists recently, there's a couple words that come up very often. And if you ever interview at Sports Performance, good for you. It's the same conversations that are always had. And there are two words that come up. Growth is one of them. Growth. I want to grow. I want to be the best, and I want to surround myself with the best. And to me, that's beautiful. Like, that brings up my passion. I get fired up about that, because I do too. And I want to be surrounded by the best. And that's why when people interview, I want to hear that, but I also want to feel it, and then I want you to show me, right? So there's a difference. And I ask, growth is something that we all want, right? I asked someone recently, what's the difference between learning and growth? And they were stumped for a little while, right? What's the difference? And learning is, obtaining information, reading, listening, doing everything else. And growth is actually implementing and learning from that information. So learning is just accepting it all and just processing it, but doing nothing about it. Yeah, you learned a new cooking recipe, but you never used it. You just learned it. It's not really worth anything until you implement it, practice it, try it, do it, modify it, own it, and that's growth. And so, as a new grad, and you're trying to get into sports PT, you have to be about growth, true growth. And I think that in school, you've just learned. You got out of school and they just threw 3,000 textbooks at you, and all you had to do was put it into the brain and then regurgitate on exam. Now you're in practice. Now you're actually implementing it every day. And like everybody on this planet, you're going to get stale. You're going to get stagnant. You're going to get caught in the same routine, because you're human. And then putting yourself in an environment where people are like, no, 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 no. You said you wanted to grow. Let's do this. Start changing this up. Why aren't you doing that? Add this. Read another research article. What podcast you listening to? Tell me more. Here we go. And that's true growth. And I think you want to put yourself in an environment like that. Most people who are listening to this podcast want that. You guys are all motivated. I know. I can see it and hear it. And that's the feedback that I get. They're like, Chris, I love your podcast. I love it because it's outside of the like normal stuff. It's putting me in a position where I can think differently. That's great because that's what the environment that you want to be around. You want to be around like people who are just changing the way that you think, the way that you view things, not just teaching you things to learn, is to now grow from that. How does this make me a better person, a better clinician? How do I see my patients and clients differently? How do I truly help them if they're an athlete going into high performance? If they are a weekend warrior going into competing locally in higher level competitions, getting people to grow as well. And so, as a new grad, set the destination. What do you want? You want to become a master clinician. Put yourself in that environment that you are going to succeed in and thrive and grow. And if you choose, your first environment is dangerous because you are like a sponge. You're so passionate, you're so motivated. And then if you get yourself in an environment where you're like, oh man, I'm just treating 3,000 people a day, no one's really motivated, you're tainted. You're gonna, it's hard. So maybe you're a new grad and you already have that job, or you put yourself in a good position, good for you. But if you have that, rethink like, all right, how can I switch my plan over the next couple years? Because getting in environments that aren't going to push you, you're just going to be learning and not really growing. And that's a big difference. If you're a new grad and you're learning and not growing, you're almost just like listening to podcasts but not really being able to use them. You're reading books, you're taking CEUs but not really being able to use them because no one's teaching you and asking you every week like, how did you change your framework? Why did you do that differently? What's the reason for this? How would you do this differently? What if it was a different case? Those questions, yeah, you're going to ask them to yourself, but you only know what you know, so you're only going to go so far. And so, again, if you have this be the best personality, like we all have it, especially on this podcast, if you have that, you have to be willing to grow. You got to put in the time, you got to put in the hours after hours, on weekends, trying to figure out if you're not like in the shower or driving or working out and thinking about that patient or client. You're like, man, what would I have done differently? Should I have done linear plyometrics a little bit longer before I did lateral plyometrics? Should I have done eccentrics and less concentric? Should I have done isotonic? What should I have done? Those are the conversations in your head that you should be having. And if you're like laughing and smiling, you're like, yeah, that's definitely me. That's you. And that's what I'm saying. Like you got to put yourself in that environment. And so it doesn't have to be a lot of people. It could be, a smaller practice. It could be a larger group. You just want to have people who maybe, and certifications, I'm not an alphabet soup type of a person, but people who have extra certifications. But I think ultimately when you arrive in that facility and you meet those people, that's the game changer. Everybody can be single credentialed PT, DPT, MPT, bachelor PT, doesn't matter. I don't care about that. What I do care about is the personality and the energy in that room and the culture. And when you have a culture of people who are, you walk in that place and you like love it, and they're pushing you and they make you feel like you're on fire, that's the place you want to be. It's not necessarily just a specialty. It doesn't mean that they're a master clinician just because they have certifications. What makes them a master clinician is their passion, their experience, how they put that all together, how they make people feel. I mean, just everything about that. So you have to have that. So number one, set the destination. Number two, stay accountable. Don't just learn. You got to put yourself in and grow and put in that time and effort and be willing to do that and stick to it. That's the hardest part. As we get more experience, we get more complacent. Here I am, let me see, 2013 years into this profession, and I'm hungry. I want it. I want more. I want to figure out why, the hows, and how do I get, more PTs to push them in that same domain. That's the passion and fuel I have still 13 years later. Um, and then ultimately, as you go through this journey, decide on what gives you fulfillment. Um, does treating 37 people a day give you fulfillment? Or does changing people's lives give you fulfillment? You can still have both, but you have to remember what gives you fulfillment is the value you bring to people. It's the, not just like, oh, I'm pain free. It's the response after that. It's like, I can pick up my grandkids now. Like that's the fulfillment, right? And I think we lose sight of that once you start getting certain outcomes, or you like you're in the mundane kind of routine. You forget like why you're doing this. You're so caught up in the like, man, I just got to do this. I got to get the knee pain. I got to stretch this. I got to ice this. I got to tell them the HEP program. I got to write a progress note. When you're in that mode, you actually forget like why you're doing this. And so think about your fulfillment story. For me, it's my grandma, right? So every time I get challenged with like, is this on the same route? Am I still enjoying what I'm doing? And I think about my grandma, I'm like, the way I made her feel and gave her quality of life back, that's what I have to reflect on. And like, do I get that same umph with where I'm at? And then if so, what do I need to revamp? What do I need to change? Do I need like an extra day off? What do I need to reset that clock and revisit? Am I still getting that fulfillment? And that's pretty deep for a lot of you. But think about why you got into PT. What was that story? And are you still feeling that with where you are in your professional career? Give you an answer. So always keep that in the back of your mind. Think about what sets you apart. And then this one is the point that I was mentioning to you before. It's called shiny object syndrome. We all have it. There's always shiny things coming at us. If you set the destination, you're really excited about your career and where you want to do, or where you want to go and what you want to do, and then you found that environment that is going to keep you there, and you know that your story of fulfillment, like you feel fulfilled in everything that you do, you're bringing value to people's lives. Every day, every minute, you will be given different shiny objects in the form of professionally, you're going to be given different opportunities of employment, job opportunities, do this specialty, do this certification. If you're like, man, I'm going to get my SCS exam, and you set that path for 3 years out, and then somebody says, hey, man, I just took the CSCS exam, and that's going to take another 6 months, but that's going to derail you from the focus. Or they're like, hey, I really think you should take this year-long residency in manual therapy, and you're like, man, but that's going to take me off of my SCS pathway. You're always going to have the shiny object syndrome. You're always going to have things coming at you, right? It's like you're dating somebody and you met the person of your dreams, and this person's amazing, and somebody comes in, an old ex-partner comes back in your life, and they're like, hey, are you single again? Like, there's always going to be things thrown at you, and professionally it doesn't change, especially as a new grad, as you're becoming more experienced in everything that you do. You're always going to have temptation all over the place. Somebody who wants to become an OCS or an SES, it's a hard path in the sense that you just have to stay really rigid with your education. You have to be good with your studying time. You have to keep that consistent. And so if you don't stay on that path, you're going to be 5, 6, 7, 8 years out before you even consider sitting for the exam. So be mindful of this shiny object syndrome. And a little bit about my professional career. Yes, I did do professional sports. Yes, jobs were presented, and I had to follow through and make sure that the interviews and everything went well professionally. But in a good sense, I was definitely thrown that shiny object. I just knew I wanted to work with professional athletes. I knew I wanted to work in sports, and I had that opportunity, and things were just thrown to me outside of that, and I just stayed focused on what I wanted to do and get really good at my job. And then I did more concierge, kind of one-on-one with a professional athlete, and we traveled the world. And then actually more temptation came in. Other athletes, more athletes ask, hey, why don't you jump on board? And I had to do what was right and stay with somebody and stay committed so I can get good at it, versus just jumping to the next one. So, and this applies to new grads. It's going to be very tempting to jump from one job to the next because it's like that next shiny object. But what you have to do is consider, like, what's the goal? Like, what did you set out to do? What's your fulfillment story? Like, why are you here? Why did you get into PT? And stay true to those two things as you go on. And a lot of you, are on that path right now, and maybe you're realizing like, man, I am doing this, I'm just jumping from place to place to place, and it's because you got to figure out what makes you happy. Like, set that tone first, set it versus trying to find it. Set what makes you happy versus trying to look for it and find it. I get it. These are the conversations I have with interviewees. Like, what do you want? Like, how, like, because then I can facilitate that. I love clinicians and PTs who know what they want, and they're like, I want to be the best. Perfect. Are you willing to learn and grow and stay accountable? Yes. Perfect. You're going to put in time. You're going to do, podcasts, books, articles to support everything that you do, and work on progressions, rehab therapy progressions, so that people actually get outcomes. Yes. Perfect. What's the 3 to 5 year map look like? And I'll help facilitate that. And that's what you ultimately want. You want to set that. And if not, uh, if you don't have a 3 to 5 year plan, you don't have, uh, you just want to learn, don't really want to grow, you're not really into the accountability, you're just kind of going with the wind, you're just going to float. So, of course, when things are presented to you, you're going to jump on it. And then you're going to take this, and then you're going to move on to this. And then in the end, it's hard. You have very little certifications. You haven't taken much con ed because you dabbled in this, and then you went to home health here, and then you went to pediatrics here, and ortho here. There's nothing wrong with that. I'm just speaking to the people who want to be in sports PT. There's a difference. My audience and the people I'm talking to, you, the passionate, motivated person who thinks about their ex and treatment skills while they're working out and driving and doing everything else behind the scenes. Those are the people I'm talking to. So if that's you, these recommendations are for you. Every new grad, I mean, this can be, if you're a PT student or a new grad or even experienced PT who's like, I thought ortho was for me, but I want more sports. This is for you. Anybody who's interested in sports PT, it just depends on where you are on that whole stage and that whole cycle of learning in your professional career. So, uh, number one, if you're going non-residency, find an environment that excites you, like just gives you passion. Then decide on what gives you fulfillment, like why you got into PT, so that those two things keep you on the right path. From there, you got to stay accountable. Don't just learn, you got to grow. You got to put in time. You have to put in the work. And if that's not right for you, don't put yourself in these environments, because you're just going to be trying to learn and everyone's trying to be pushing you, and you're going to be like, this is too much for me. So you have to know where you are in that stage. So for the people who are growth minded, that are looking for that work environment to excite them and keep them passionate, decide on that fulfillment. Don't be set off by shiny objects. Keep on that path. And then last but not least, just enjoy the ride. Enjoy that ride and just coast. So that way you have guards on the sides when things are coming at you. You're like, nope, I know my path. I'm going to do it. I don't care what Instagram says, or the influencer on Instagram is telling me to do, or the YouTuber is telling me what to do, or the podcaster is telling me what to do. I have my path. And once you do that, those individuals, that plan, those people are set up for success. Set the destination and stay with it. Don't just go with the wind and be pushed around with the climate of the day or the climate of the week or the climate of the month. There will always be things there to distract you, especially today, nowadays with media. The minute you pick up your phone, you change your mind in like 30 seconds, and it's all over the place. And so for me, I highly encourage that you set a plan and set goals, annual, quarterly, to make sure that you're on that right track. And if you're not writing your stuff down and keeping yourself accountable, you're just going with the wind. So I hope that helps for all you listeners, whether you're a new grad, PT student, experienced, veteran, I don't care what you call yourselves. We're all in the same stage, just at different times of the year, at different times of our life. You might be transitioning from one specialty into sports, and it's very relevant to you. Either case, this is the plan that will set you on that right path to be successful, to be the master clinician. That was a term that was in an interview recently. I want to be a master clinician. And I asked what does it mean to be a master clinician? And it takes time. to get there. And it takes a lot of reps, but more than anything else, it takes the right mentorship and the people around you and sticking to that plan and sticking to the reps. And sometimes things will get a little bit mundane and they actually feel like the same, but you're actually continuing to grow. There's the one caveat. If you're working every day and you're feeling like you're not even learning or growing, that's a challenge. If you're working like every day and you're actually getting challenging cases, but it seems very mundane, but you're continuing to grow, that's called stability. Enjoy that. We all aspire to be there, where you don't feel uh, anxious about anything that's coming in. You're like, I've done this before. I can easily do it. Feels like the same thing. I can totally do that. That's great. You're getting closer to that master clinician. That's like where you want to be. And for some people, that's scary. They're like, is that okay to feel that way? Absolutely. You're getting it now. That's the place to be. And then it's just one level up. You just keep going. So I hope that helps. And I hope you guys are staying healthy, enjoying life, and being fulfilled by what you do. That's ultimately what it's about. All right, guys. I'll see you guys on the next episode. Take care.